Hi, everyone. I'm Namrata Sanjeevi, Research Associate at the Washington State University. I'm very happy to share the findings from a recent publication on food insecurity and mental health that has been co-authored with Dr. Pablo Monsavies, who is an associate professor at the Washington State University. Mental health conditions in children and adolescents are a public health concern due to its immediate and long-term effects on overall health and well-being. In 2016 to 2019, the estimated prevalence of depression, anxiety, and behavior problems among children and adolescents in the United States were 4.4, 9.4, and 8.9% respectively. Although episodic depression and anxiety in childhood may increase risk of mental health problems and poor functioning in adulthood, this risk is greater in children and adolescents who chronically present these conditions. Despite the risks associated with long-standing mental health conditions, studies indicate that a substantial proportion of children with mental health disorders continue to have these conditions in later life. Thus, there is a critical need to identify factors that impede or facilitate resolution of mental health issues during crucial stages of development. While studies have identified food insecurity as a risk factor for diagnosis of mental health conditions, its impact on unresolved mental health issues is not understood. A direct comparison of food insecurity status of children with resolved mental health symptoms to those with ongoing problems is needed to understand its role in impeding resolution of mental health conditions. The objective of this study is to investigate the association of food insecurity status with diagnosis and resolution of depression, anxiety, and behavior and conduct problems in children and adolescents using the National Survey of Children's Health data from 2016 to 2019. Household food insecurity status for this study was assessed using response to the question, which of these statements best describes your household's ability to afford the food you need in the past 12 months? Based on which households were classified as food secure, mildly food insecure, moderately food insecure, or severely food insecure. Negative response to the question on whether a healthcare provider had ever told the parent or caregiver that the child has depression, anxiety, or behavior conduct problems was used to identify children who've never been diagnosed with these conditions. Those responding affirmatively were additionally asked whether the child currently has this condition. Negative response to this follow-up question was used to identify children with resolved mental health conditions, whereas a positive response was used to classify those with unresolved conditions. Using logistic regression analyses, we found that mild, moderate, and severe food insecurity was significantly associated with higher odds of being diagnosed with depression, anxiety, and behavior and conduct problems. However, in children, only severe food insecurity was significantly associated with higher odds of unresolved behavior conduct problems. Further, in adolescents, severe food insecurity was significantly related to greater odds of unresolved depression, anxiety, and behavior and conduct problems. These findings suggest that tailoring interventions for youth from severely food insecure families, such as by mitigating hunger and improving the psychosocial adjustment, could be a vital component of their mental health care. Thank you so much again.